1 in 3 Hong Kongers will be above the age of 65. While it's easier for city dwellers to find medical resources in the urban setting, it's harder for seniors living on outlying islands like this. And I'll find out what it takes to make sure they don't fall through the cracks, especially as the demand for geriatric services increases. Whether it's hanging by the beach or savoring local street eats, Hong Kong's outlying islands are a swift escape from the urban bustle. But look closer, and you'll see that it's an economy run mostly by older residents. There are more than 195,000 people living on outlying islands in Hong Kong. As of 2023, over 15% are above the age of 65, up from 14% in the previous year. But even as residents get older, their living environment remains unchanged.
Here in Chengzhou, a dumbbell-shaped island that's a 40-minute ferry ride away from Hong Kong Island, the 20,000-strong population lives mainly in the middle section. Now, the terrain can get pretty hilly, so you see village houses like this built onto the slopes. And getting home can be quite a trek because the lanes are steep and narrow, and there's no form of public transport here, so residents either walk or cycle around.
The islanders are a hardy bunch. They don't mind a walk. But it's not great for seniors who need more mobility support.
腳而家老咗就膝頭哥咧退化啦，緊有㗎啦。我以前都行山啊，後尾越行越痛。個醫生即係睇骨科㗎，你唔行唔到㗎啦。你即係年紀大，嗰啲骨骼咧呢啲咧退化㗎啦，行平路咯。
辛苦都要行咯，當做運動又唔辛苦㗎啦。你每日行幾轉都係對身體好嘅，唔係變大肥婆咯。來回咧1個鐘咯，即係好遠㗎。我哋住嗰度140幾級樓梯，140幾級樓梯嗰度咪跣親咯，整親咯，哇幾驚啊，幾驚行唔翻啊，自己慢慢爬翻起身，睇下點樣行到就翻屋企捉藥走咯。
I caught up with the island's district councillor, Kok Waiman, who grew up in Chengzhou. She tells me at least 40% of the residents are elderly. As most of the younger family members work in the city, the seniors often depend on themselves to buy groceries or get around.
80-90歲咧都係要翻屋企嘅，佢哋屋企嘅路程咧都幾有遠嘅，有啲近嘅，可能幾分鐘已經到啦。但係因為我哋成個長洲咧係圍住個山而建嘅啦，咁有啲翻屋企咧要翻成個幾兩個，即係個幾鐘頭先可以翻到屋企嘅。當真係唔方便或者係有身體唔舒服啊，或者係有病痛嘅時候咧，其實佢哋都有啲求助嘅。咁我哋長洲咧都有好多唔同嘅服務啦，譬如有家福會啊，佢哋可以送飯啊，或者咧我哋都有啲 volunteer， 我哋啲義工咧都會咧幫佢買下餸啦。但係咧，如果係大嘅問題，可能都係用到政府資源會比較多啲咯。我哋都冇交通，我哋靠自己雙腳咧。我哋行到去睇佢嘅又好啦。如果行唔到睇佢嘅，可能佢哋都要去醫院啊，或者住一啲安老院啦。當然嗰啲宿位都唔係好夠嘅。
St. John's Hospital on the island, for instance, provides emergency services. Residents with mobility issues can also tap on medication delivery and telehealth services. But for more complex cases, they need to call in the big guns.
We have about 1,600 cases per year. So normally, after receiving the call, the first concern is what kind of call nature, such as stroke or heart disease or short of breath, etc. Luckily, our aircraft equipped with most advanced equipment. We just think about the severity of the patient. If it is no immediate life-threatening condition, we will land on another helipad and then transfer by ground transport. If the patient needs immediate care, we will just land on the rooftop of one of the urban hospitals in Hong Kong.
The Government Flying Service, or simply GFS, handles search and rescue operations and medical emergencies. Aside from the air crewmen who are medically trained, the GFS also has 67 healthcare volunteers on the roster.
So this is our row bay, and this is our medical equipment.
We have more medical expertise that we are able to provide to the patient. So say, for example, we can provide advanced airway interventions, so we can intubate the patient, we can give drugs to the patients, we can insert IV lines and all that stuff, so which normally only be available in hospital setting. Paramedics are not accredited to do.
He may be a seasoned emergency doctor, but working on a helicopter is a whole other challenge. Dr. So's volunteered with GFS for 6 years now.
We only have a few minutes on ground to think about the case and to be prepared for it. Because since we are airborne, there's no more access to equipment. It's unlike the hospital setting, where you can easily ask for help. The information that you get, we usually get only like 1 or 2 sentences, very brief description of what's going on with the patient. We don't have access to the medical record that we normally do in the hospital setting. So we have to work with very limited information in very limited time, have a mental picture of what's going on, and to get all our stuff ready. So the patients, really deteriorates during the transfer, and we can give them a very timely intervention.
Next up, we'll join GFS on one of the response missions. When the siren goes off, the clock starts ticking down. And the team sometimes must make a snap decision, like whether to take along controlled drugs that may be temperature sensitive. We spent a few days with the government flying service, or the GFS, to understand what goes on behind the missions.
We're flying across the Victoria Harbour right now, and we're moments away from landing in Chongzhou. The case we're on is categorized B, which means the crew has 2 hours to complete the mission. If it's categorized as A, which means a little bit more critical, the crew only has about 20 minutes to finish the mission. It is pretty straightforward, but the crew still has to be laser focused because the weather can change any moment, especially during summer months.
In fact, before we took off on one of the flights, there was a sudden downpour. The pilot had to wait for rain clouds to clear before plotting the quickest route. Once the craft lands, the crew has a quick word with the doctor, and the transfer is done within minutes.
More than 2/3 of our workload for aeromedical transfer are patients over 60 years old. So patients have heart problem, chest problem, infection. We also see patients with trauma injury as well. Patient may have a fall, then have a broken hip, have a head injury. We also see patients, elderly patients with surgical conditions as well. One of the issues that for elderlies living in the outlying islands or really other remote areas in Hong Kong is that they need to have timely access to emergency care.
Especially in cold day or in extreme hot weather, you can expect a more senior person will have call out because of their breathing or heart problem. So in our in-house training, we will focus on geriatric, the care. They have different pathophysiology from normal adults.
Over half of the calls GFS responds to are from medical emergencies. But a citywide labour shortage in the healthcare sector does pile on the pressure. So GFS has had to work with clinics on the islands to provide joint training on patient transfers.
If needed, we can send our auxiliary doctor or nurse to have a stabilization on scene first before transfer to the urban area. Hospital authority, they already try their best to recruit more doctors and nurses, but the resources is limited, But I think that primary care is very important too, which means that we can maybe deploy more doctor and nurse to the clinic, do the basic treatment first, help to prevent the crowding situation in our urban public hospital.
Over 80% of Hong Kong's public healthcare expenditure went to specialist treatments in 2022. Less than 20% was used for primary healthcare. It's common for private doctors to refer stable or minor cases to specialists. In fact, the Hospital Authority found that up to 65% of total cases at the A&E in the past decade was stable and non-life-threatening.
In Hong Kong, we still rely too much on the what we call the secondary prevention, which is when the disease happens, we treat them. But we don't do primary prevention, which happens to prevent the disease from happening in the first place. All the people in Hong Kong have a mentality that when we are sick, we go to emergency room. And that creates a problem because they don't see the doctors in a primary care setting. And that's create immense burden for the hospital setting.
Hong Kong introduced a blueprint in 2022 to standardize primary healthcare services throughout the territory and to ease the burden on hospitals. This means residents can go to any district health center to access a range of services, like traditional Chinese medicine, chronic disease health screenings, and physiotherapy. Think of it as a one-stop shop. Hong Kong believes that the reform could save about 28% on healthcare expenses and prevent 47,000 deaths.
Primary healthcare focuses on prevention and early detection and diagnosis, especially using chronic diseases such as hypertension and diabetes as an example. If you can detect and diagnose these two conditions early, you will be able to avoid complications. That will help us in the long run, not just to improve our people's health, save life, but also to save money in our overall public healthcare expenditure.
The problem is hiring enough healthcare workers to make this work. There are over 16,400 doctors in Hong Kong as of this March. That means only 2 doctors serving every 1,000 patients, a ratio far lower than other advanced economies. Hong Kong must play catch-up.
係增加資源人手，政府近年係大力咁投放嘅資源喺培訓醫護專業人員方面。唔同嘅醫護專業嘅培訓學額喺6年之間大幅增加咗50%。除此之外，繼住早前嘅我哋修訂咗醫生註冊條例，開闢咗新途徑引入非本地培訓嘅醫生。我哋亦都先後向立法會提交咗條例草案，引入非本地培訓嘅護士同埋牙醫。
This could also be expanded to non-locally trained allied health workers like radiographers and occupational therapists. That would take time that senior residents may not have. Living on an island can be relaxing. Rent is cheaper and the pace of life is slower. But you're pretty much planning your day around ferry schedules. Now, ferries come every 20 to 45 minutes depending on the time of the day. And it also gets suspended in times of extreme weather like typhoon. So if that happens, or if you miss your last ferry, be prepared to bunk in for the night, because this is the only mode of public transport connecting the islands to the city. This time, I'm heading to Peng Tsao, a 40-minute ferry ride away from the city. The small island is relatively flat and is just under 1 square kilometer. Peng Tsao used to be an industrial hive in the 60s, home to as many as 8,000 people. Today, only 6,000 remain. About 1,000 are elderly. Instead of a hospital, residents have about 4 medical clinics, including 1 outpatient clinic, which offers 24-hour first aid services.
It seems like there's a service gap, but the helicopter can help in a very acute emergency situation. But in my view, there should be more resource related to providing those long-term care, such as daycare centers, such as elderly home, such as kind of broadening those home-based services, because those are kind of the day-to-day needs. When the opportunity came in 2022, I applied and trying to set up this daycare center to provide an alternative for the elders here.
Silvermorph Charity Centre is tucked away on the ground floor of a public housing estate. It's a quiet corner, but inside, 90-year-old Lee Loy Hay lives with a son who's in his late 60s. As a senior himself, he needed more support with his caregiving duties. So Mrs. Lee spends most of the day at a daycare center down the road.
我都來咗成10次咯，有做下運動啊，幫下老人家啊，邊度唔舒服啊，幫下佢按下摩啊，係嘛我都識㗎，佢啲人佢係平洲人嘛。
The charity currently serves around 30 residents in Pengzao.
We provide anywhere from home care, that means activity of daily living, bathing, showering, meal assistance, do nursing care. We also do rehabilitation by physiotherapists, occupational therapists, speech therapists. We do medical escort. We also provide some of those home modification assessment, make sure that they live in a place that is more elder-friendly.
The center only has 3 full-time staff, but with the range of services it provides, it's had to be creative to deal with labor constraints.
One thing that we try to do is try to hire everyone from the island, so kind of do this, they can serve their own residents. They take quite a lot of digging. So the occupational therapist, she actually lives here. We have a physiotherapist, his grandma lives on the island, so every weekends he will come over to visit, so it's kind of like in a part-time or freelance basis.
The charity is one of at least 4 that keeps a close eye on seniors, affording them the dignity to age in place.
知道有啲咩需要咧，都譬如有啲我哋派福袋啊，我哋有陣時都會做到咧，我哋都可以陪下佢出去應下診。義工嘅重要性嘅就係可以即時幫，即時可以行動去幫到佢咯。因為有陣時佢靠屋企人啊，咁可能啲仔女返晒工，咁未必即刻趕到嚟。
呢個就係你細女啊？係啊係啊。
有陣時咧就係血糖高，有陣時就唞氣唔到，唔順氣。4次直升機同埋1次水警，我上工。咁去到嗰個阿 Sir 就好搞笑，你可唔可以揾個後生啲啊？喺間屋裏邊啊，一個90幾，我係最後生啊。
75-year-old Cheong Kamui has lived on Pengzao her whole life. Her daughters have moved to the city for work, so the house is quieter these days.
咁多數邊個照顧你哋啊？
初初問我，佢照顧我照顧佢啦。後尾3個女又夾錢請阿姐，姐姐呢個真係超好啊佢。 又護理得咧，又泥水都識㗎。
And if she needs an extra pair of hands, community support is just a call away.
食咗早餐未啊？食咗。哦，2餐。
我哋熟悉咗大家，熟悉個環境，熟悉佢嘅需要咯，先至係幫到其他人。如果唔係嘅，譬如你俾一個貿然陌生人去咧，佢要從頭去打聽、打探。 再探問睇下點樣先知道你嘅需要係乜嘢。
我喺平洲住咗20幾年，覺得啲街坊好好，大家互相幫助。有時啲老人家啦，有咩事幹啊，上去睇下老人家，幫下老人家買下嘢。
因為平洲比較細，咁咧就所以我哋呢度咧居民就好比較親近啲啊，所以咧大家咧我哋都會就算唔係參加樂齡會。 點樣咧？我哋大家都會好親近，就係即係喺呢度咧，就會聚集埋一齊，更加緊密啲咯。做任何事都，啲街坊啊聽到，咦你有啲乜嘢啊？咁啊我哋咪問下譚生佢哋，你可唔可以幫下佢啊
These grannies are part of the Pengzao Happy Aging Project, which organizes weekly home visits. The social calls can last from a few minutes to over an hour. The project, which launched in 2019, also recruits young students to engage the seniors.
呢個計劃其中一個重點，亦都係推廣區裏邊嘅居民互相幫助，同埋一啲嘅伙伴去幫我哋嘅一啲嘅居民嘅。例如頭先我哋講話有啲嘅維修，例如個長者盞光管壞咗嘅時候咧，就幫佢維修，換咗盞光管佢啦。有啲長者可能咧個窗邊滲水喎，會有啲義工幫佢哋擠下啲玻璃膠啊，又或者有啲長者廁所可能要整個扶手喎，有啲義工幫佢哋整個扶手。呢啲睇落係一啲好小修小補嘅嘢，但係咧係喺個長者嘅生活嚟講咧係幫咗佢好多嘅。
Trained social workers also provide counseling, caregiving support, and even assist seniors with their applications for subsidies or care homes. But most of the activities take place in the heart of the island, the community centre.
咁我哋咧就會有一啲嘅一般性活動啦，包括一啲嘅體育活動，即係例如頭先佢哋講椅子舞、拉筋活動，同埋可能會有一啲嘅其他嘅書法啊、茶道啊，或者其他唔同類別嘅活動都有嘅。咁呢啲活動咧，其實同佢哋嘅身心健康都有關係嘅，即係多啲同人社交啊，又或者得閒做下運動啊，其實都維持到佢哋嘅健康嘅。一樣最明顯咧就係咧。佢哋咧係會個人咧比較性格係會開朗啲，同埋咧係多啲朋友一齊去同佢哋去面對困難嘅時候咧，佢哋咧係會個人會樂觀啲、積極啲嘅，心理上會健康咗嘅。
The demand for these services will surely grow as Hong Kong's population gets older. Although city life affords better medical access, the islanders prefer living out their golden years here on their own terms.